Hi everyone, I am Marlena and this is Talk with Marlena. I would like to speak about the most common psychological disorders. And it is so common, and I know they are because they came up on many of my research papers and it was like redundant. So I actually decided to do my very first PowerPoint presentation on these two comorbidity. So that's anxiety and depression. And guess what? I won an award for one of the best PowerPoint presentation. I was like number one. Can't believe it was my very first one. So nice and fun, old school, thick board. I still have it. I got it really fancy printed. And this was like 10 years ago, and that cost $200 just to print out this little cardboard. Um, so yes, let's get into it. So, well, there are three actually, but I've only addressed two. We kind of know why the third one is. The third one is PTSD, which is known by post traumatic stress disorder. Why? Maybe because a lot of veterans, people who not only served in the war, but their family members, their children, their spouse, they can all also suffer from PSD just by having a family member have something bad that had happened to them. Maybe, for example, an event that is not related to someone you know that have gotten hurt. Maybe the Twin Towers, the terror attack. That can cause PTSD. And actually, I can say it's true, even though I wasn't there in New York when it happened, but I can tell you, I did feel nervous when I was at Ground Zero in New York. I did feel like a pit of my stomach like empty. It's like it dropped. You know that feeling when you're on a roller coaster ride and it's just like, ooh. That was the feeling I got when I was at the Ground Zero in New York City when I seen this square and there was this huge hole and then there were like fountains of water just flowing down, and all I can just think only thing I can think is that this kind of resemble the souls that kind of, you know, crumbled or went inward with the buildings. But it was very moving, emotional, and wow, I was getting like tears in my eyes just being there. And it's still very, right now, heavily portrayed. But so that could be a form of PTSD, just being nervous to go around there, not even wanting to go there because you're afraid something else may happen. But let's get into the two main ones, even though there are three common ones, but the two main ones. So these account for about 30% of all diagnosis in America. So I'll say mental health diagnosis. So I could share my screen a little bit with you. Let's see. Unfortunately, I don't have any idea about the timing, but I'm excited about this. Let me try to share my screen. There you go. All right, so depression. Depression is also referred to major depressive disorder, but there are a lot of versions of that just kind of keep going and going and going. I do have my DSM book here, and then I have another one, and actually there's another one that was recently published about 2 years ago. Let me pull this out. So, it's so heavy. I need to buy a third one. This is our Bible. Wow. That was a job to put all these little tabs, but actually they came in handy. Even the tabs were expensive. The tabs probably cost like $100. The book itself, I think it starts off like 500 or something. It's a very expensive book. It's a very expensive book. So, yes, depressive disorder. It's so dark here. I cannot see. I see sleeping disorders. Um, where is it? Where is it? Adjustment disorder. Oh, the personality disorder. Schizophrenia, oppositional. So these are the childhood disorders. Those are in the beginning. So yeah, this is our Bible. But I think right now we really don't want to get into all the different types of depression because it may be overwhelming. So, how do we know we are depressed? How? How can we say we're depressed? Let's get this advertising down. There are some signs, symptoms, and characteristics that are related to those who show signs and to help indicate that you may be suffering from depression. So, here are some of them. Difficulty concentrating. Now, that sounds very broad, right? What does it mean? You lose your keys? I mean, it can mean a lot of things, but in general, it's more of a severe point to where you are no longer focusing or is interrupting in your daily life function. So, this is the main thing for us when it comes to diagnosis. If it's really bad, it's affecting your normal day of living, your normal routines, how you would usually go about your day, your work, your school, your family, your friends, relationship. Whenever what you have starting to interrupt with that, then that means it's becoming a problem. So remembering things, having fatigue, having pessimism, meaning like a little negativity or just feeling like they say hopeless, feeling guilt, shame, helpless, and maybe it could have been related to some incident. Sleeping is also a main thing. People I've noticed before when I was working in private practice, usually they had a lot of problems sleeping, staying asleep, falling asleep, or they slept too much. So either way, it's a problem, right? Irritability, that to me is a key signature sign somebody's depressed. And sometimes we don't know. You may just think, oh, this person is complaining or they're being difficult or complicated, but that is a sign of depression. So what else we have? Loss of interest of things that are enjoyable. Just say, for example, a person used to listen to music or they used to engage in certain hobbies, and now all of a sudden, in order to do those things, it takes so much effort. Just say, for example, if you wanted to go for a hike, you will postpone it, or you wanted to go for the hike at 10 a.m., but you really don't get out till like 2 or 3 p.m., and everything is just kind of dragging. So, and you don't even enjoy it anymore. When you do go on that hike, it's like, oh, torture. It's taking forever. You're just not having fun. You just want to hurry up and get back home into your like cubby hole. Overeating or undereating, as they would say, loss of appetite, and that is very common, I would say. Aches that don't seem to go away. Now that one is kind of hard to pinpoint because when they say aches, that's kind of broad and vague. I don't even think that's in the DSM for sure. I never heard of that. But for sure, digestive problem is very common, and that's probably more on the anxiety part of diagnosis. And like it says here, feeling sadness, anxious, emptiness, suicidal thoughts or attempts. Like that is like the severe. I think that's when it has become very extreme where you need to seek help. What kind of help do you need? It depends on how severe the depression is. So if your symptoms are quite mild, and mild could be maybe severe to the next person. A mild can be, okay, you're not eating for several days, you're losing a lot of weight, you're becoming weak, and you're not sleeping, so now you're delirious, you're not concentrating, now you're leaving your door open by accident, or just something that could cause it can be very dangerous because you haven't slept well and you're driving at night and you're falling asleep because you haven't slept, because you haven't treated your depression. So that's why it's very important to see how one thing can lead to something else and it can just build up. So certain treatments may work for one person and not the other. Depending on how severe it is and if it's the first episode or not, most likely getting therapy, and just say, for example, maybe even just start with a group, a support group. So I would say that would be like the beginner minimum start of seeking help. Maybe a support group just to have somebody to relate to understand you, and you feel like you have somebody that is listening. But if that is not enough, then that's when you want to seek a professional, mental health professional. That can be a LCSW, licensed social worker. It can be also an intern or AMFT, ACSW, or okay. I think they're associate too, like AMFT, like associate marriage family therapist, a counselor, but they are called, I don't know what they're called because my degree is not in counseling. Mine is psychotherapy, but also a psychologist. So those are the people you need to seek help from as far as getting psychological treatment. Um, for me, it's better to, because of my background and the psychology and the focus was all mainly psychology. Personally, I would go with a marriage family therapist, or I think, what do they call them? Clinical counselor or some type of counselor. Um, and a social worker, I am not that familiar with how they become specialized, because social workers mainly work with children and family and children who's going out of the system, but they do also do therapy. So, and if that does not alleviate symptoms, and if those coping skills and going to therapy seeming not to help, then you would either call your insurance company or request some referrals from your clinician, referrals for a psychiatrist to get a psychiatric evaluation. And so what they will do is, psychiatric assessment. Sorry, I'm just making sure I got the words right. So they'll do an assessment, and they'll just kind of pinpoint what your chief complaint is, your symptoms, and the psychiatrist will determine what type of medication will be best for you, how many milligram, the dosage, how often you need to take it. And so you can go from there and monitor if your symptoms are getting better, and always make sure that you are keeping your psychiatrist up to date. Like, please don't just go off your medication, because that can be very dangerous. One common thing is very common where, let me close this out. I want you to see my beautiful face now. One thing that is very common, which I don't know if you can see my face like this, is that when people start to feel better, oh no, there it is. When people start to feel better, what do they do? When they're taking medications, just guess what happens. This is very common for people who are diagnosed with bipolar, from my experience when I worked in a treatment center. So the symptoms may not start to alleviate right away or immediately. It may take a month or two or three. And then all of a sudden it's like, whoa, I'm feeling great. I'm like, oh, like, I'm stable mentally, and like, why am I taking these pills still? I don't need these pills. I feel good. I don't need those anymore. I'm doing great. So, okay, they stop taking their meds. What do you think happens? Maybe after the first day or two, nothing happens. Maybe a week or so, a few weeks. All right, so your brain was being fed all these chemicals for all this period of time, and then all of a sudden, it stops. Your brain now is being deprived. Your brain goes into shock. And then what happens? Then the person behavior changes drastically, significantly. Then they can go into a manic episode. They can become suicidal. They may become like delirious or anxious or depressed, and It's very like it depends on the person and their chemical in their brain and their bodies and how it's processed. But this is why it can be very dangerous to just stop the medication, because it can just like send your signals like out of whack basically. So that's happened a lot, and I've seen that a lot. A lot of people come because of that. They stop taking their meds. Sometimes when they come there, they need meds, and then they become stable, and then they feel like, oh, I don't need it anymore. Another thing, people try to substitute the medication. They try to self-medicate, and when we say self-medicate is because usually people know they feel anxious. So what do they do when they feel anxious? What would be the opposite? They will drink alcohol. Why? Alcohol is a depressant. It relaxes and calms you down, calms the symptom. Sorry, the symptoms too, but it also calms the system. So people will just drink and drink a lot, and then they start to become in this area of alcoholic because this is their form of treating themselves, and so it's very common that people are doing that, and usually it takes some time before they can trust and want to take medication and become clean of whatever substance they were using. And that can go with any drug. For example, if somebody is always sad or depressed, they may want to take an upper. Have you're probably not used to those terms. They used to call them uppers and downers, like uppers and downers. So right now it's very, very interesting and crazy how they have this new rap song out talking about Percocets. Well, they had one before, Percocet, Molly Peckers. Yeah, they're talking about Molly's Percocet. Now there's another one. How did you come to the party and forget the perks? And I just thought, wow, this is so sad. I'm so glad this is not my era, because I could imagine these young kids thinking like, this is cool, we should take this. And I really don't know that much about Percocet. All I know is very strong, and that it's supposed to be very addictive and have these really strong results. I only know one time, one occasion when I was a caregiver, there was a lady. She was a cancer. I don't know if she was in remission. I don't think she was, but she was a cancer patient, and she had some kind of bone cancer, which was very painful. She had to wear a brace, a body brace, because I guess it kind of helped to, I don't know, I guess it helped the pain, but she would have Percocets. It was highly controlled, like her, husband and caregiver would give it to her, but it was like a big deal to give it to her. It wasn't like, hey, take it. No, I think you can OD on that too. Is that, or there was another one that was very oh my god, it's very morphine. I think maybe it was morphine too. But I know also morphine is like a very strong drug, and I only known one person in my life had that, and that was after being treated for cancer. So that tells you how extreme it is, that drug, when they give it to cancer patients. So there's no way a regular individual should be taking that, period. So the video is already over 15 minutes. I want to keep these short and sweet. So I want to get into the second diagnosis, which is anxiety. I think it's very common. And actually, I teach an anger management class. And in one of the videos, it tells us that anxiety can be good for you. Anxiety, sometimes it gives you motivation. It makes you want to work towards things. So anxiety can be good. But too much anxiety can be bad. And why it can be bad, I will tell you. Let's screen share. Well, there's a list there of doctors if you need.